Let's jump right in. Welcome to this explainer, where we're going to unpack the hidden mechanics behind medical billing and coding. Have you ever actually wondered what happens to a patient's chart after they walk out of the clinic and how that translates into real revenue? Well, today, we're mapping the entire anatomy of a clean claim, starting from the bedrock of compliance all the way to the final payout.
Everything we're diving into today is sourced straight from Carty Bin's incredibly comprehensive guide, Everything Medical Billing and Coding. Honestly, this text is basically a masterclass in the field. We're going to use it to give you the structured, practical knowledge you need to master this absolutely crucial side of healthcare.
All right, let's look at our agenda for today. We've got 5 key areas to cover: the foundation of compliance, mastering E&M codes, the anatomy of an E&M visit, the magic of billing modifiers, and finally, navigating insurance networks.
Starting with Section 1, the foundation of compliance.
Now, a clean claim means absolutely zero if it isn't legally compliant, right? Before a single code is even typed, a practice has to safeguard patient privacy. Congress passed HIPAA back in 1996 to establish a strict, nationwide standard for protecting health information. Every single provider, insurance company, and biller has to stick to these federal regulations. It's the absolute non-negotiable baseline of medical administration.
And this brings us to a really crucial point. How does HIPAA apply in today's world of remote work? When a coder is working from home, the office obviously has way less control over their environment. Because of this, remote coders have to maintain strict HIPAA compliance by using dedicated private spaces. I mean, you can't have your roommate casually walking by with their morning coffee and seeing patient data on your screen. You have to rely on encrypted faxing or secure remote dial-ins to access the provider's systems.
Moving right along to Section 2, mastering E&M codes.
So, now that our foundation is solid, let's transition to the actual language of billing. E&M stands for Evaluation and Management. Literally, these codes are the bread and butter of the medical billing world. They represent the physician's time spent assessing a patient, noting their observations, and coming up with a treatment plan. Basically, if a doctor is seeing a patient for a non-invasive service, you're dealing with an E&M code.
Now, these codes cover a massive variety of interactions, everything from your standard clinic checkup to an emergency room visit. But here's an interesting takeaway from our source. New patient clinic visits usually pay out at a higher rate than regular returning patient visits. And it makes total sense, right? A brand new patient just naturally demands more of the doctor's time to gather that initial health history and really establish a baseline.
All right, Section 3, Anatomy of an E&M Visit.
So, what exactly goes down when a patient walks into the exam room? Well, every standard E&M visit breaks down into 3 sequential steps. First, the doctor gets the background information and history. Next, they perform the physical examination. And third, they determine the suitable level of care. How these 3 steps are documented is what entirely dictates how the visit gets coded and billed.
Let's look a little closer at steps 1 and 2, the history and the exam. The golden rule here is detail. The more comprehensive the recorded background history is, and the more body systems the doctor actually examines, the stronger the case for a higher level of payment. If it's appropriate for the patient's condition, deeper documentation justifies better compensation.
But this perfectly illustrates the concept of medical necessity when we look at Step 3. Determining the level of care isn't just about the time spent. It's heavily based on the severity of the presenting condition. Carty Ben makes this super clear. A doctor absolutely cannot charge for a highly complex, high-level visit just because someone came in with a minor cold. It doesn't matter how thorough the physical exam was, the compensation has to match the actual medical necessity of the problem.
Okay, but what happens when a standard procedure involves special circumstances, or maybe takes way more time than usual? Because reality is rarely that simple.
That leads us right into Section 4, the magic of billing modifiers.
You can think of modifiers as the storytellers of a claim. They get tacked onto a code to explain the unique how or why behind a procedure. A really cool example here is how modifiers 26 and TC work together to split a bill. Imagine a patient gets an X-ray. The hospital owns that big, expensive X-ray machine, so they bill using the TC, or technical component modifier. But the radiologist who actually reads that X-ray, they don't own the machine, but they bill for their expertise using modifier 26, the professional component. And then there's modifier 22, which is used when a surgical technique just requires significantly more time and expertise than the standard baseline code accounts for.
And then we have modifier 59. The source material literally calls this the magical modifier. You see, in coding, a lot of procedures are bundled together into one single payment. Modifier 59 legally unbundles them.
It basically tells the payer, hey, I know these services are normally grouped together, but in this specific instance, they were completely distinct and justify independent payment. It is a massive game changer when you use it correctly and document it well.
Finally, let's wrap up with Section 5, Navigating Insurance Networks.
You could code a claim perfectly, but the payer network is what ultimately decides the size of the check. The big divide here is in-network versus out-of-network. Staying in-network gives you a consistent price structure. Since providers agree to contracted rates, you get highly dependable payments. Out-of-network claims, though, totally different story. Without a contract, payments get delayed and the patient's out-of-pocket costs skyrocket because the insurance company just won't cover that unnegotiated rate.
But listen, you've got to watch out for something called a silent PPO. This is a super sneaky scenario where a payer basically accesses a network's discounted rates through the back door without actually being a recognized member of that network. They're essentially cheating the provider by taking a discount they never legally contracted for.
So, how do you stop that? A competent, diligent coder is your first line of defense. You have to meticulously scrutinize the explanation of benefits, or EOB, to catch any unexpected PPO discounts on out-of-network patients. You also need to verify network affiliations before the patient even shows up. If a network is offering to reimburse at rates that are abnormally higher than usual, that's a huge red flag. They might be funneling non-network payers in to exploit the provider's services.
So are you ready to ensure every single claim you process is clean, compliant, and correctly compensated? We've covered a ton of ground today. From the strict rules of HIPAA and remote compliance, through the nuts and bolts of E&M codes and modifiers, all the way to navigating the pitfalls of payer networks.
As you move forward in medical billing, remember that you are the financial gatekeeper. Your precision, your understanding of medical necessity, and your attention to these rules directly dictate the financial health of the entire healthcare practice.
The next time you're reviewing a patient's chart, just ask yourself, is a missing modifier or a silent PPO quietly draining your clinic's revenue? Because in this field, the difference really is in the details. Please like, share, and subscribe to Decode Healthcare with Harshal.